Now, in our top story for today, the government is to launch a monthly national cleaning days to promote a healthier Uganda. Now, the government of Uganda is set to officially launch the National Cleaning Days campaign this Saturday, July 25th in Chisenyi, Chizi Zone. Campaign as part of the nationwide initiative aimed at improving sanitation, protecting public health and promoting environmental conservation. Now, according to the Ministry of Health, the campaign will see communities across the country to participate in cleanup exercises on the last Saturday of every month, with the goal of encouraging every Ugandan to take responsibility for keeping their surroundings clean. Now, the initiative is being coordinated by the government through the National Environmental Management Authority, NEMA, in collaboration with the Office of the Prime Minister, the Ministry of Health, local governments, and other public and private sector partners. Now, the campaign is to seek and to revive Uganda's tradition of community cleanup activities while strengthening public participation in environmental protection. Now, the government says that the monthly cleaning up exercises are intended to raise awareness about the proper waste management, reduce environmental pollution, and mobilize communities to maintain cleaner homes, markets, schools, drainage channels, and public spaces. Officials believe that the initiative will also help prevent diseases associated with poor sanitation, including cholera, typhoid, diarrhea diseases, and malaria caused by the blocked drainage systems that create mosquito bleeding sites. Now, the Ministry of Health has urged all Ugandans to actively participate in the exercise, emphasizing that a clean environment equals a healthy life. And health officials say that maintaining clean surroundings is one of the most effective and affordable ways of preventing disease outbreaks and reducing the burden on health facilities. Now, environmental authorities have also called upon local leaders, business, schools, religious institutions, and community organizations to champion the campaign and ensure the monthly cleanup exercise becomes a sustainable national culture rather than one-off event. Now, the National Cleaning Days campaign officially begins this Saturday in Chisenyi, Kampala, before expanding to all other districts across the country on the last Saturday of every month, as the government calls on Ugandans to work together towards cleaning and towards building cleaner, healthier, and safer communities. Let's take a look at that.
Not miss this noble call. Thank you. Ugandans, we are here as Minister of Health to remind you that 75% of the diseases can be preventable through proper hygiene and sanitation. The whole of government has come up with the National Cleaning Days every last Saturday of the month. We are starting this exercise with official launch with the Prime Minister as our chief guest on Saturday in Chisenyi, Chizi Zone, Kampala Central Division. Please be part of this, and we expect everyone to participate from 8 to 11. Please do not miss this noble call. Thank you. Ugandans, we are here as Minister of Health to remind you.
Moving on from that call to our next top story for today. Now, Ugandans strengthen polio surveillance with a new regional laboratory at UVRI. Now, Uganda has taken a major step in strengthening its disease surveillance and outbreak response systems with the commissioning of a new regional polio laboratory at the Uganda Virus Research Institute, and the laboratory was officially opened by the Ministry of Health, Dr. Jane Ruth Acheng, during the second day of Uganda Virus Research Institute's 90th anniversary celebrations. Now, she was joined by the Permanent Secretary at the Ministry of Health, Dr. Diana Atwine, and the Director of the UVRI, Professor Pontiano Kalebu. According to the Ministry of Health, the state-of-the-art facility will enhance Uganda's capacity to detect, monitor, and respond to poliovirus more quickly while supporting neighboring countries through the regional laboratory services. Now, the laboratory is expected to improve disease surveillance, laboratory diagnosis, and early outbreak detection, which are the critical and that will help to preventing the spread of polio and maintaining Uganda's polio-free status. Health officials say that the laboratory will analyze stool samples collected through the country's acute flaccid paralysis surveillance program, enabling scientists to rapidly identify any saturation of poliovirus and guide public health interventions before outbreaks occur. Now, speaking at the launch, Dr. Acheng said that investing in modern laboratory infrastructure is essential to strengthening Uganda's health security and ensuring the country remains prepared to detect and respond to emerging public health threats. She noted that strong surveillance systems are key to protecting children from vaccine-preventable diseases and supporting regional disease control efforts. Now, Permanent Secretary Dr. Diana Atwine applauded the continued partnership between the Ministry of Health, UVRI, and international health agencies in building Uganda's laboratory capacity, saying timely diagnosis remains one of the most effective tools in preventing disease outbreaks. Now, meanwhile, Professor Pontiano Kalebu, director of the Uganda Virus Research Institute, said the new laboratory reflects Uganda Virus Research Institute's continued commitment to scientific excellence and innovation as the institute marks 90 years of advancing medical research and public health. Now, he added that the facility will strengthen collaboration with World Health Organization's Global Polio Laboratory Network and contribute to regional efforts to eradicate the polio disease. Now, the Ministry of Health has urged parents to ensure that all eligible children receive routine polio vaccinations, emphasizing that immunization remains the most important and effective way to protect communities against the disease. Now, health officials say that the new regional polio laboratory will play a critical role in safeguarding Uganda and the wider East African region against poliovirus by strengthening surveillance, improving laboratory diagnosis, and enabling faster detection and response to the potential outbreaks. Now, from that story, coming to our next story. Now, Rwanda receives over 147,000 mosquito nets to boost malaria prevention. Now, thousands of households in Rwanda district are set to benefit from a major malaria prevention campaign after the district received 147,300 long-lasting insecticide-treated mosquito nets from the national medical stores through the Ministry of Health. Now, the mosquito nets will be distributed across the 70 parishes in the district as part of the Ministry of Health's national-wide mass mosquito net distribution campaign aimed at reducing malaria infections, preventing deaths, and strengthening household protection against mosquito bites. Now, speaking during the handover ceremony at Rwanda District Health Office, District Malaria Program's focal person Grace Tuliakira said that the national campaign is conducted every 3 years to replace the worn-out mosquito nets and ensure communities continue to receive effective protection against malaria. Now, she explained that the ministry allocates one mosquito net for every 2 people in a household in line with national distribution guidelines, noting that the previous nationwide campaign was conducted in 2023. Now, Tulia Kira said that the new consignment is expected to significantly improve malaria prevention efforts by increasing household coverage and reducing the transmission of the disease, which remains one of Uganda's leading causes of illness and deaths, particularly among children under 5 years and pregnant women. Now, representing the Ministry of Health, Abirahim Kanathan said that the delivery of the mosquito nets marks the beginning of implementation phase of the campaign. He explained that the next steps will involve training district health teams and village health teams, registering beneficiary households and conducting door-to-door distribution to ensure every eligible family receives the nets. He called on local leaders, health workers and residents to support the exercise to ensure the campaign is implemented successfully. Now, Rwanda District Vice Chairperson Percy K. Safari welcomed the government's continued investment in malaria prevention, noting that the district's population has grown to more than 248,000 people, making the intervention both timely and necessary. She urged officials overseeing the disease to ensure the mosquito nets are distributed fairly, transparently, and without discrimination, with encouraging residents to sleep under the nets every night to maximize their effectiveness. Meanwhile, Assistant Resident District Commissioner Hilary Bindeba called for proper storage and handling of mosquito nets during distribution, especially in phrases and in these parishes with limited storage facilities. He also urged implementers to ensure casual workers involved in transportation of the nets are paid promptly for their services. Now, health officials are now urging all households in Rwanda district to use the mosquito nets constantly and correctly every night, saying that the campaign is expected to protect thousands of families while supporting Uganda's long-term goal of reducing malaria as a public health burden. Now, from that, a success story for coming in from Rwanda district. Moving on into our next story for today. Now, Uganda has strengthened its position in a regional leader in infectious disease research after the Uganda Virus Research Institute was officially designated the East African Community Regional Center of Excellency in Virology. Now, the announcement was made during celebrations marking the 90 years of the Institute's collaboration to medical research and public health at its headquarters in Entebbe. Now, the new destination places Uganda Virus Research Institute at the forefront of regional efforts to strengthen disease surveillance, laboratory research, and preparedness of infectious diseases outbreaks, including Ebola, Marburg, and other emerging viral threats affecting East Africa. Now, in a message delivered by the Prime Minister Robin Nabanja, President Yoweri Kaguta Museveni congratulated the institutes on the achievement, describing Uganda Virus Research Institute as one of Uganda's greatest scientific success stories. Now, the president praised the institution for its decades of groundbreaking research and its contribution to improving public health both in Uganda and internationally. So, as part of the anniversary celebration, Uganda Virus Research Institute also unveiled a museum highlighting its rich scientific history and major contributions to disease research over the past 9 decades. Speaking at the event, Prime Minister Robin Anabanja reaffirmed government's commitment to investing in scientific research, saying strong research institutions are essential for improving healthcare and strengthening Uganda's preparedness against future disease outbreaks. Now, meanwhile, the Permanent Secretary at the Ministry of Health, Dr. Diana Atwine, called on scientists to focus on developing practical, evidence-based solutions to the emerging public health challenges, emphasizing that research must continue to respond to the evolving health needs of communities. Now, the ceremony was attended by senior government officials, including Speaker of Parliament, health experts, and development partners, who praised Uganda Virus Research Institute's continued contribution to disease surveillance and scientific excellence. Now, officials says that the recognition of Uganda Virus Research Institute as the East African's Community Regional Center of Excellence in Virology is a major milestone that will strengthen regional health security, enhance scientific collaboration, and reinforce Uganda's leadership in the fight against the infectious diseases and the outbreaks to come. As TV1, we'd like to congratulate Uganda Virus Research Institute for marking its milestone of making 90 years in a service. Moving on to our next story and the last one for today. Now, WHO urges countries to accelerate action to eliminate meningitis in the whole world by the year 2030. Now, the World Health Organization is calling on countries to strengthen efforts to eliminate meningitis as a public health threat by the year 2030, warning that the disease continues to claim hundreds of thousands of lives every year and leaves many survivors with lifelong disabilities. Now, meningitis is a serious infection that causes inflammation of protective membranes surrounding the brain and the spinal cord. The disease can spread rapidly and, if not diagnosed and treated early, can lead to hearing loss, brain damage, permanent disability, or death. Now, to accelerate global action, the WHO recently convened regional workshops in Denmark and Cairo plus Egypt, bringing together policymakers, public health experts, and technical specialists to strengthen national meningitis programs and improve preparedness against the future outbreaks. Now, according to the organization, the meetings are focused on helping countries strengthen disease surveillance systems, improve laboratory capacity, enhance outbreak detection, and expand immunization programs. Participants also reviewed national meningitis response plans and identified practical strategies for improving prevention, diagnosis, and treatment, and long-term care for the survivors. Now, the workshops also provided an opportunity for countries to exchange experiences and learn from the successful meningitis control programs in nations such as Brazil, Colombia, and the United Kingdom. For Uganda, health experts say that the recommendations are particularly relevant as the country continues to strengthen disease surveillance systems and laboratory networks to improve preparedness for infectious disease outbreaks. They note that early detection, prompt treatment, and routine immunization remain the most effective tools for preventing meningitis and reducing the deaths. Now, the World Health Organization says that it will continue providing technical support to countries through regional partnerships, knowledge sharing, and practical guidance to help translate national plans into measurable public health gains. Now, speaking after the workshops, Anton Deropt, coordinator of WHO Defeating Meningitis by the year 2030 roadmap, said stronger collaboration among countries is essential to saving lives and reducing disability caused by the disease. Now, the World Health Organization says that defeating meningitis by 2030 will require sustained investment in immunization, disease surveillance, laboratory systems, and public health awareness, urging governments and partners to work together to protect communities from one of the world's deadliest infectious diseases. Now, to you, our dear viewer, those have been the latest health stories from Uganda and around the world. Up next, we'll shift our focus onto today's health discussion, where we'll take a closer look at an important health topic with our health expert guests, providing practical advice, answering your questions, and sharing information that can help you and your families live healthier lives. Stay with us for more on Your Health Show, only at TV1 Uganda. See the difference.